This is Pat Iyer, and I am pleased to bring to you Dr. Peter Salgo, who is on the staff teaching resident and intern physicians about anesthesia, about being an intensivist, and about medicine. He is a professor at Columbia University and works full-time taking care of patients. Peter is going to be one of the speakers who will be joining us for our September 23, 24, and 25 2021 Legal Nurse Consulting virtual conference. Peter, I'm so pleased to have you with me today as we talk with our viewer about some of the highlights of what you're going to cover when you are presenting your talk for us.
It's my pleasure to be here.
When we discussed this topic initially, we were going on the concern that many attorneys have about whether there is indeed pain and suffering after a person has been injured. And we could be involved in cases that involve a short period where a person's injured and died, or extended long days, weeks, and months of pain and suffering. Can you give our viewers some of the highlights of what you're going to be covering when you're speaking to our legal nurse consultants?
Well, sure. I think it's probably best to start off with a definition. What is pain? What is suffering? How do we appreciate that neurologically? What does it mean to us emotionally? And then we have to break it down a little bit. What causes pain? Clearly, if there's been an injury, then there are signals which are going from the injured area to the brain. How do they get there? How do we appreciate this? How does the brain analyze this? What does the brain need to have to understand the nature of the injury and to experience the pain and the suffering? Then we need to evaluate, obviously, the neurologic pathways. We need to evaluate the consciousness, which is maintained or not maintained. And a lot of this can be gleaned from the circumstances of the accident, for example, if it is an accident, the police reports, the EMT reports. Often you'll have video of what happened so that you can actually see what's going on. In today's world, a great deal of what we do is recorded, whether we know it or not. The cameras are out there. And then when the victim is taken into some sort of medical facility. It could be as simple as an EMT response at the scene, or later when transferred to a hospital, you're going to get a lot more information. And this information is physical exams. It's going to be laboratory results, and then an awful lot of nurses' notes. And I've always found that the truth is always somewhere buried in the chart. And often the best place to look is the nurses' notes. Doctors come by and they do a great job. They drop in, they evaluate patients, and then they go on and do the rest of their daily business. Nurses stay at the bedside. And so for a really good look at what's happened to a patient, you often simply go to the nurses' notes and read them. And, I can't tell you the number of times an attorney has called me and said, I'm going to send you the chart. You don't need the nurses' notes. I'll just send you the quick stuff. And I said, no, please don't. Send me the important stuff, which is often the fine print, the detail inside a chart. So the nurses often record the mental status, the nurses record the pain scores. And then you have to use your judgment as a physician reviewing these charts as to what happened. What happened in the hospital? What procedures were performed? Do they hurt? What kind of an anesthetic was provided? And were they able, given the clinical situation, to provide enough medication to be sure that there's no pain and no suffering? Because often these patients are hypotensive. And as we know, when you give medication to control pain, you drop the blood pressure. And so it's always a desperate kind of balancing act between medication and blood pressure, and the patient is sort of caught in the middle. So it's going to be an interesting discussion to discuss how to go through a chart, understand where the pain is coming from, what it means to the person, understand how the chart records this. And then going forward, I think it's always useful to try to make a judgment as to, if the patient survives and goes forward, whether there's permanent disability, whether the person understands the disability and what this means emotionally, and certainly if there's continuing pain, what this means to a patient going forward after the event. So it's complicated, but the devil's in the details. The details are in the chart, and often those chart details are in the nurse's notes.
You are so right. When I think about all the assessments that nurses make and the various pain scores, the detail of symptoms, of measurements of wounds, of drainage, there's a plethora of details. Legal nurse consultants are trained and rewarded for being detail oriented and being able to pull out those pieces for the attorneys they're working with. Your perspective as a physician is in this area is fascinating, and we'll talk about how you look at pain and suffering versus how an LNC would look at pain and suffering, where you shine in this world, and how you can help attorneys.
Sure. And it's also worth noting that the medication records are important. That's certainly part of the nurse's notes, but you've got to take a look at exactly which medications were given when. As one example, you got to look at whether or not paralytics were given, vecuronium, rocuronium, succinylcholine. Once those are on board, then a lot of the information and clues that you've got as to the patient's state of comfort is removed. And so a nurse's note that says, zero pain has to be correlated to what medications were given. Mm-hmm. Paralytics on board, well, then we have to reevaluate that.
Yeah, that's a great point. I so look forward to having you as one of our speakers at our conference. And be sure, if you have not signed up for this conference, please go to this link, http://lnc.tips/September 2021 virtual. That link is right below this video and on this video, so you can't miss it. And we will see you at the conference.
It's going to be fun.
Thank you, Pete.